antimycotic or antifungal drugs, and basically they are used to treat fungal infections, and there are several of them. We have the polyenes, fluoridated pyrimidines, imidazoles, synthetic triazoles, glucan synthesis inhibitors, and then the synthetic allylamine derivatives. So for each of these, we'll look at one prototype or look at the group. So the polyenes prototype is amphotericin B and then Nystatin. And amphotericin B is widely used for severe systemic fungal infection. So when we talk about systemic fungal infection, we are talking about fungal infection that is generalized, maybe causing sepsis or causing meningitis. It's available in several forms, and there are also lipid-based preparations, and these may decrease renal toxicity. Then Nystatin is only used topically or orally. So sometimes it's administered to the mouth for oral thrush, and then topically for vaginal candidiasis. After IV administration, so amphotericin B, because it's used for systemic infections, it's given IV. So after IV administration, it is administered, it is distributed throughout the body, excreted by the kidney. And as for oral Nystatin, it undergoes little or no absorption because it is given topically. And the little that is absorbed into the systemic circulation is excreted on change in the stool. Amphotericin B works by binding to sterol. So if you look at the fungi, its cell wall is made up of ergosterol. And so amphotericin B binds to the ergosterol, and then this leads to changes in the permeability of the cell wall of a fungus, causing intracellular components to leak out and thereby destroying the fungus. So that's how amphotericin B works. It is usually fungistatic, but when you give it in high concentrations, it's fungicidal. So fungistatic means that it inhibits the growth of the fungi, and then fungicidal means it kills the fungus. Now, Nystatin binds to the sterol in the fungal cell membrane, also leads to change in the permeability of the membrane and then destruction of the fungi. So depending on which organism is present, it can be static or cidal. And so, like I said earlier, it's usually used for severe systemic infections and meningitis. So if you have something like cryptococcal meningitis in a patient with HIV, you can give amphotericin B to treat it. It is usually reserved for severe fungal infection because it is highly toxic. So some of these are Candida, Paracoccidioides, blastomyces, and Cryptococcus neoformans. That's what typically causes the cryptococcal meningitis. It's also effective against the fungi that have been listed. And because it is highly toxic, you usually give it to patients who have life-threatening infection. And you need to monitor the patient closely. So if you think that there's a patient who needs amphotericin B, then it's best to refer this patient to a tertiary center. So Nystatin is used to treat candidal skin infections. And you can also use it to treat skin mucous membrane infections like oral thrush or diaper rash in a baby, vaginal and valvular candidiasis, and then candidiasis between the skin folds. because it is given topically, there isn't much by way of drug interaction, but with amphotericin B, it interacts with flucitosine, and the interaction is synergistic. What this means is that it amplifies the effect of the flucitosine, and they are commonly used together to treat cryptococcal meningitis because of this synergistic effect. And when you give amphotericin B with the nephrotoxic medications like aminoglycoside, the risk of kidney toxicity is increased. And when it is given with corticosteroids, penicillin, and digoxin, the hypokalemia that is produced is worse, and this can lead to heart problems. Also, you shouldn't give it with muscle relaxants because it can increase their muscle relaxant activity. Usually, when you are administering it, it must be mixed with 5% dextrose. And so you don't use saline. This is very important when the nurses are mixing it. So it needs to be carefully mixed so that you don't lead to further problems. Sometimes the patients may have problems with their magnesium and potassium levels. So you need to monitor kidney function and electrolytes closely during therapy with amphotericin B. The usual adverse reactions are diarrhea, nausea, vomiting, abdominal pain, and then a bitter taste in the mouth. So it's not only malaria that gives a bitter taste in the mouth. The topical Nystatin can cause skin irritation and a hypersensitivity reaction. So if you prescribe it and the patient comes back with itching or erythema, it could be from some other side effects that are experienced are chills, fever, vomiting, anorexia, muscle and joint pain, and indigestion when it's given at low doses. Patients can also develop anemia. I already mentioned the electrolyte imbalance. Okay, so let's look at flucitosine. If you remember, I was saying that flucitosine can be given with amphotericin B in the treatment of meningitis and cryptococcal meningitis, and there's a synergistic effect between the two medications. So flucitosine is an anti-metabolite which acts as an anti-mycotic. So an anti-metabolite is a medication that is part of the metabolic pathway, and it mimics one of the components. But then when it is incorporated in the metabolic pathway, it doesn't lead to the production of the desired end product. And by disrupting metabolism, it helps to kill a particular organism. So flucitosine is an anti-metabolite. It is a purine and pyrimidine inhibitor. Remember, these ones are used in DNA synthesis. So go back to your biochemistry and revise purine and pyrimidine. So it inhibits purine and pyrimidine, and it is used to treat systemic fungal infection. So after it is given orally, it is well absorbed from the GI, it's widely distributed. It undergoes little metabolism and is excreted mainly by the kidneys.
Hello, Doc.
So what it does is that it penetrates the fungal cell wall, and then inside the cell wall, it is converted to fluorouracil. And this fluorouracil is incorporated into the RNA of the fungal cell. And changes their protein synthesis and causes cell death. So it's apart from being used to treat meningitis, cryptococcal meningitis, it is also used to treat candida infections of the lower inner tract. For example, if you do a urine culture and then you culture candida, it can be used to treat that, the candida UTI. So when you give flucitosine with tiotarabine, which is also an anti-metabolite, and it is used in cancer chemotherapy, treatment of leukemia, there is antagonism of the antifungal activity of flucitosine, so you shouldn't give them together. It's also important to monitor the hematologic, the kidney, and the liver function because there's a risk of serious toxicity. Some of the side effects include confusion, headache, drowsiness, vertigo, and then hallucinations. There's also difficulty in breathing and then the usual GI symptoms as well as rash. Imidazole. So imidazoles are a very common antifungal medication. The prototype is ketoconazole. It is the most commonly used imidazole, and it is an oral anti-mycotic drug. It has a very broad spectrum of activity. It is given orally, it is absorbed, distributed widely. It is metabolized by the kidney and excreted through the bile and the stool. So what it does is that it enters the fungal cell and interferes with sterol or ergosterol synthesis. Ergosterol is a steroid component of the cell membrane of the fungus. So once it interferes with the synthesis of the ergosterol, it means that the integrity of the fungal cell wall will be damaged, and then it will increase its permeability, and you will have leakage of intracellular elements out of the cell, leading to inhibition of cell growth and then ultimately cell death. So it is mostly used to treat topical and systemic infections, and this includes dermatophytes and most other fungi. The commonest use for ketoconazole is the treatment of tinea capitis. Drug interactions. So if you have medications that would decrease the gastric acidity, they would lead to decreased absorption of ketoconazole. So these are the anti-ulcer medications, antacids, the cimetidine, the ranitidines. All these medications would decrease the absorption of ketoconazole because they decrease gastric acid. So what you do is, when you take these medications, delay the administration of ketoconazole by at least 2 hours, by which time there'll be gastric emptying. When you take ketoconazole with phenytoin, which is an anti-epileptic medication, it will alter the metabolism of both medications and thereby lead to an increased blood level of the drugs. And then when you give it with theophylline, it decreases the serum theophylline level. So also when you give it with an anticoagulant, it can cause hemorrhage because it increases the effect of the anticoagulant. So for example, if you give ketoconazole with warfarin, the patient could bleed excessively. It shouldn't be given with rifampin, which is one of the anti-TB medications, because the levels may decrease. Then also the metabolism of these medications will be decreased. So quinidine, sulfonylureas, carbamazepine, and protease inhibitors. So the common adverse are the nausea and the vomiting, but less frequently they can have anaphylaxis, they can have joint pains, and then they can have ringing in the ears. And it's very important to take note of the impotence here, so that when you are addressing such a problem, consider this medication and ask for it in the drug history. Liver toxicity can occur, but once you stop the drug, the liver toxicity is reversed. Then the synthetic triazoles. Examples are the fluconazole, itraconazole, and voriconazole. These are also quite common on the market. And what they do is also by inhibiting the synthesis of ergosterol, which is a vital component of the fungal cell membrane. Now, when it is given orally, about 90% of it is absorbed into the bloodstream and is evenly distributed into all bodily fluids. More than 80% of it is excreted unchanged in the urine. And the bioavailability is greatest when it's taken with food. And it's more effective if it is taken, voriconazole is more effective if it's taken 1 hour before or after a meal. But that of fluconazole is best when taken with food. So they are metabolized in the liver and they are excreted in the stool. So when you look at the mechanism of action, it inhibits the cytochrome P450, which is responsible for the ergosterol synthesis in the fungi. And this causes the fungal cell walls to weaken and thereby leading to increased permeability and then osmotic instability. Because what happens is that when there's increased permeability, there's
Hello, Doc. Hello, Doc. Your line is quite bad.
She's playing music.
Piano na.
Piano.
Hello, Doc.
Keyboard where they cast you. Wow, it's so nice.
I'm pay school phone in the kasana. I'm pay school phone. I'm no kasana.
Pressure me too much.